The new report, called Fit for the Future, looks at the role the UK Health Service should play in tackling climate change and is jointly produced by the environmental group Forum for the Future and the NHS Sustainable Development Unit. It is the first time the NHS has studied the long-term measures required to maintain a quality health service in the UK in the face of climate change.
We're launching a document today called Fit for the Future, which sets out a series of scenarios to help people plan for a sustainable future for the National Health Service against a backcloth of increasing pressures to reduce carbon emissions.
The document says the UK Health Service emits 18 million tonnes of CO2 each year, the largest carbon footprint of any other public service provider in Europe, and high carbon prices will squeeze its budgets unless it changes its practices. The aim is for the NHS to transform itself into an efficient low-carbon operation in order to provide the best quality health care.
Not many people have heard of the idea of low-carbon health services. It doesn't resonate in the public mind as yet, but it pretty soon will, because as the UK sets out to achieve these very ambitious reductions in CO2 and other greenhouse gas emissions, we have got to make a priority of the health service and reducing greenhouse gas emissions directly and indirectly caused by the health service in the UK.
The report also states that the NHS has a key leadership role to play in creating a more sustainable society in the UK. Its massive size and reach mean that it can have a great influence on British society as it transforms itself into a low-carbon service.
The NHS is a huge organisation, and you won't be surprised to hear that it has a huge carbon footprint. And unless we can find very clear ways of reducing that footprint as fast as possible, there are no serious prospects for a low-carbon Britain. It's as simple as that. If you want to talk about low-carbon Britain, you have to talk about a low-carbon NHS. So this is the reality for all health managers now, for anyone working in any part of the health system, for those organisations that partner with health organisations, primary care trusts and so on. This is the reality. We have to work together to achieve these reductions.
Recommendations for change include increasing the amount spent on the prevention of disease, helping people take greater responsibility for their own health and making greater use of information technology.
There are a variety of measures that we include in here. I mean, these aren't just measures about the National Health Service. They offer societal, political, environmental scenarios, the like of which we can't predict with any degree of accuracy in 20 years' time. And they say to people, within these scenarios, how will you plan for providing sustainable national health services? It's very interesting when we look at the moment and how we can improve quality and improve productivity. Measures in my region, for example, 60% of them are consistent with a low-carbon national health service. So, for example, providing care for people nearer to their homes so people don't have to travel so far. For example, thinking critically about drug prescribing costs and the use of pharmaceuticals. Thinking critically about health and well-being through exercise, through strategies to reduce obesity, respiratory illnesses and so forth. These are all part and parcel of the actions which NHS bodies need to be thinking about as part of the future.
The report provides 5 key steps to creating a sustainable low-carbon healthcare system which is prepared for whatever the future may hold. Its authors believe the NHS is uniquely positioned to play a leading role in shaping a more sustainable future for the UK.